Imagine going to the doctor for a stuffy nose, only to find out something was alive and growing inside you. This woman's bizarre medical mystery left surgeons stunned, because what they pulled out shouldn't have been there. Today, we're diving into one of the rarest medical cases ever recorded. Stay tuned. This story is wild. In 2009, a young woman walked into a clinic in Saudi Arabia seeking help for what she thought was a simple, if persistent, health problem. For years, she had struggled with a completely blocked left nostril that made breathing difficult. At first, she assumed it was just allergies, or perhaps a chronic sinus infection, the kind of nuisance health issue many people learn to live with. But as time went on, and the problem not only persisted, but seemed to be getting worse, she knew she needed professional help. Little did she suspect that her journey to diagnosis would uncover one of the rarest and most bizarre medical anomalies known to science. When initial treatments failed to provide relief, her doctors decided to investigate further. A routine nasal examination revealed nothing unusual, prompting them to order more advanced imaging. The CT scan results were shocking. Clearly visible in her nasal cavity was a dense, bony structure that shouldn't have been there. At first glance, it appeared to be a small growth or abnormal bone formation. But upon closer inspection, the truth was even stranger. The object had the unmistakable shape and structure of a fully formed tooth, complete with a crown and root system. This was no ordinary nasal obstruction. It was a medical phenomenon so rare that most doctors go their entire careers without encountering a single case. The condition, known medically as an intranasal ectopic tooth, occurs when a tooth develops outside the normal dental arch. While teeth occasionally erupt in unusual locations in the mouth, cases where they form entirely separate from the gums are exceptionally uncommon. In this woman's case, the tooth had somehow developed deep within her nasal cavity, gradually growing larger over time. What made this particularly remarkable was that the tooth wasn't just a calcified mass. It was a living, growing part of her anatomy, complete with blood vessels and nerve connections. This explained why her symptoms had progressively worsened over the years. As the tooth grew, it took up more space in her nasal passage, causing increasing obstruction and discomfort. The origins of such ectopic teeth remain something of a medical mystery. Some researchers believe they may result from displaced tooth buds during embryonic development, while others suggest they could be remnants of our evolutionary past, a throwback to when human ancestors may have had different dental arrangements. Trauma to the face during childhood has also been proposed as a potential cause, though in many cases, including this one, there was no history of injury that could explain the anomaly. The tooth's presence in the nasal cavity was entirely spontaneous, with no clear explanation for how or why it had developed there. Preparing for the surgical removal required careful planning. The tooth's position deep in the nasal cavity meant surgeons had to navigate a delicate operation to extract it without damaging surrounding structures. Using specialized instruments and guided by real-time imaging, the medical team successfully removed the entire tooth, roots and all. The immediate relief was noticeable. For the first time in years, the woman could breathe freely through both nostrils. Laboratory analysis confirmed it was indeed a complete healthy tooth, indistinguishable from those found in a normal dental arch, except for its highly unusual location. This case raises fascinating questions about human development and the potential for our bodies to produce such unexpected anomalies. Teeth developing outside the mouth belong to a category of growths called choristomas, normal tissue growing in the wrong place, as opposed to tumors, which are abnormal tissue growths. While most people will never experience anything this unusual, cases like this remind us of the incredible complexity of human biology and how, occasionally, the developmental processes that normally follow such precise patterns can go slightly awry with remarkable results. The implications extend beyond just medical curiosity. For dentists and ENT specialists, such rare cases underscore the importance of considering unusual diagnoses when common explanations don't fit. They also highlight how much we still have to learn about human development and the potential for our bodies to produce such extraordinary variations. In an era where medical imaging has become increasingly sophisticated, we're likely to discover more of these rare conditions that would have gone undiagnosed in previous generations. For the woman at the center of this story, the resolution was both simple and life-changing. After years of unexplained breathing difficulties, a single surgical procedure restored her normal nasal function. Yet her experience serves as a powerful reminder of the human body's capacity for the unexpected. It makes one wonder, how many other people might be walking around with similarly unusual growths, completely unaware until symptoms develop, or by pure chance during medical imaging for unrelated issues. This case also opens up interesting discussions about human evolution and development. Some scientists speculate that such anomalies might represent atavisms, the reappearance of ancestral traits that have been lost during evolution. Could this ectopic tooth be a faint echo of our evolutionary past, when our ancestors' dental anatomy might have been different? While this remains speculative, it's fascinating to consider that within our DNA may still lie dormant instructions for developmental pathways that occasionally and unpredictably resurface in rare individuals. Beyond the scientific implications, stories like this capture our imagination because they challenge our understanding of what's normal and possible within our own bodies. They remind us that despite all our medical advances, the human body can still surprise even the most experienced doctors. They also serve as cautionary tales about dismissing persistent symptoms. What begins as a minor annoyance might turn out to be something far more unusual, requiring specialized treatment. In the end, this woman's story had a happy resolution, but it leaves us with lingering questions about human biology and the strange twists that can occur during development. It stands as a testament to the importance of thorough medical investigation and the value of advanced diagnostic tools. Most of all, it serves as a remarkable example of how even in our modern scientifically advanced world, the human body remains capable of producing mysteries that both challenge and expand our understanding of medicine and human development. The next time you have a stubborn, stuffy nose that won't go away, you probably don't need to worry about having a tooth growing in your nasal cavity. The odds are astronomically against it. But this case reminds us that in medicine, as in life, sometimes the most unlikely explanations turn out to be the correct ones. It's a humbling thought that despite all we know about the human body, there are still extraordinary surprises waiting to be discovered in the most ordinary of places, even something as mundane as a stuffy nose. Want more insane medical mysteries? Smash that like button, subscribe, and hit the bell, because tomorrow we're covering a man who grew a hairball in his stomach for 20 years. Trust me, you don't want to miss it. And let me know in the comments, what's the weirdest thing you've ever had stuck in your nose? Until next time, stay curious.